The healthcare system can seem like a bit of a maze.
In the grand scheme, a skilled nursing facility is just one part of the spectrum of healthcare.
Most often, they come right after a patient leaves an acute care hospital.
Skilled nursing facilities is basically the second step in the scheme of the continuum of care.
The acute hospital is a procedural building. They do a surgery or they do emergency care, but we recover those patients. We help those patients rehabilitate and go home.
You start at an acute care hospital and your goal is to move to progressively lower levels of care.
Once a patient has reached a point where they don't require specialized care in a skilled nursing facility, or if they reach a point where they're ready to go home, the next point in the continuum would be home health therapies and home health nursing to help the person in the home and to adapt into their home situation.
There are things like boarding care, assisted living, home health.
From the acute to the SNF to the boarding care or assisted living.
And each has its place in the grand scheme.
And home health provides intermittent care. They do not provide day in and day out care. For instance, a patient going home from acute hospital with home health orders will only receive nursing or rehabilitation services 2 to 3 times a week. Versus in the skilled nursing facilities, they will provide that service is provided day in and day out.
Assisted living is really mostly those patients who will be independent in their care.
The patient being discharged to that setting has to do a lot of the care themselves.
There's never a plan to send the patient back to the hospital.
If they go back to the acute hospital with the same diagnoses, the acute hospitals will not get paid.
Over the last decade, nursing homes have turned into rehabilitation centers where really it's just a way station between a hospital and going home.
In order to avoid rehospitalization, we work very closely with the nursing staff, the clinical team, to implement certain systems.
Being in a skilled nursing facility is a great place for that patient to go to transition safely. You still have a level of supervision and you still have a level of medical care that you're receiving because you have your nurses that are there 24 hours a day, 7 days a week.
And then we have the nursing staff around the clock to care for the needs of the resident.
So that they're aware of certain changes in the patient, and therefore we can intervene promptly.
You have your rehab services that can help your patients get stronger and prepare for the things that they'll have to deal with when they return to their previous environment.
Understanding where a skilled nursing facility fits in can be helpful while navigating through these healthcare waters.